I'm Roland Beres with Idaho News 6, and as part of your Health Matters series with Regence Blue Cross, we have been focusing on mental health in the state of Idaho and what can be done to improve it in this difficult time. It's always been difficult in the state of Idaho. Lack of resources, as many states face, has always been an issue, but right now we're dealing with, of course, coronavirus. We're dealing with the loss of jobs, losing loved ones, isolation, sickness, and then add to all of that the holidays on top of it, the lack of sunlight. Well, let's face it, there's a lot to talk about. So we started a series of mental health seminars to bring together experts in the field of mental health to answer your questions and provide insight into the difficulties that so many of us are facing right now, and hopefully with ways to help you find relief. You can post your questions, by the way, below on our screen. As we go in real time, we can get answers from the experts to your questions. So send them in, what other questions you may have. So let's introduce who we have tonight. The experts that are joining us tonight: Danielle Pierre, Bureau Chief for the Idaho Division of Behavioral Health. Also, Dr. Jim Polo, Executive Medical Director with Regence Behavioral Health, and Jacob Wilson, a licensed social worker with St. Luke's Health System. Hope I got that all right, everyone. I know this was sort of a last-minute thing here, but thanks for joining us all. Everything good with our introductions?
Yep.
Yes.
Excellent to have all of you along. It's such an important time, an important issue. Let's begin, you guys, with the state that we're in right now, dealing with coronavirus. Here we are 10 months into dealing with this difficulty, and it's at the worst point we've ever been. So let me go around the table here and talk about where we are in terms of mental health status in the macro picture in the state of Idaho. And Jacob, maybe I can begin with you since you're on the ground, maybe closest to boots on the ground.
Yeah, you bet. So I think, as we all know, the COVID pandemic has been really difficult for virtually everyone for a variety of different reasons. As a part of my job, I have clinicians across the state, and so some of those pictures look different versus someone in McCall versus someone in Magic Valley or the Treasure Valley. We're definitely seeing, as usual, an uptick in referrals and requests for services as we normally do this time of year. But also with that added element of the overall community stress, fear, additional elements that COVID has brought along with us.
Jim, what are you saying?
Very much the same as what Jacob said. Keep in mind that this COVID pandemic creates just so much uncertainty. And when we're not sure of what's coming next, on one hand, we wonder and we start to think about what might be the worst thing, but it also puts us in a state of anxiety. And so what we're just seeing is a lot of people dealing with anxious feelings, not knowing what's happening next. And of course, we've got all the different things that we're doing to try to help promote decreasing the spread of the infection, which further makes it difficult. Social distancing, changing how we work. So just a lot of uncertainty that's creating a tremendous amount of anxiety among people.
Yeah, humans in general don't thrive on change. It's one of those things that's difficult for everyone, I know, and so much change coming right now. What about you, Danielle? What are you experiencing overall right now?
Sure. So I think at the Division of Behavioral Health, we're seeing three things. One is, as mentioned before, is this enduring uncertainty. We know history shows us all pandemics come to an end, but this one does seem infinite, and it's hard to face that uncertainty day after day, not knowing how to make plans, et cetera. We are also, as a state, as individuals, as communities, we're continuing to delay gratifications. We're skipping holidays with families to be safe. We are skipping vacations. A lot of things that we would normally do to treat ourselves, we're just not able to do in the same way this year. And it's hard to feel like you have nothing to look forward to. So there's a lot of fatigue around that. And I think the third thing that we're all experiencing to some degree is loneliness and isolation. And we know, especially for people that had pre-existing mental health issues, this only compounds what they're facing. And for everyone else that maybe didn't have those pre-existing mental health issues, they are maybe experiencing loneliness, isolation, depression, anxiety for the first time in their life, and just not sure what resources are there for them, what to do, how to deal with it. And also maybe some stigma about asking for help.
Yeah, the stigma always exists. There's no question about that. And for people who've never been in that situation before, I imagine that's a real problem. Before we get to starting to look into some of the solutions here, let me ask you all, because uncertainty is the big issue that you talk about with this pandemic. But here we are, we have a vaccine rolling out. So how does that change things for you guys? How much is it going to help? Could it possibly hurt in some respects? Jacob, what do you think?
So I think in some ways it's helpful to have, I guess, that proverbial light at the end of the tunnel. We feel like, we're making progress. My fear is that it'll result in some complacency with people who may get the vaccine and feel like, well, it's coming, I don't need to be as safe or take necessary precautions. I think just having, as Danielle mentioned, some of that hope down the line is helpful for our overall state.
Yeah, and let me just add on to that, Jacob, that the concern, if I understand you correctly, is that we're in a bad spot right now with people dying from this and getting sick from it. And if people start thinking that, well, the vaccine is here, things are just going to get better, and they become lax about their precautions, that we could face even more mental health issues because of the disaster that brings?
Absolutely.
Jim?
Yeah, I've got to agree with Jacob. The thing I worry about the most is that people are looking up, but maybe they start changing their behavior too quickly. Keep in mind the Pfizer vaccine, which is out this week, is a 2-dose vaccine, 3 weeks apart. The Moderna vaccine, which is coming next week, is very similar. So while we're getting the vaccine and we're going to start distributing it, we still need to practice all the precautions to prevent spread of infection. As the availability of the vaccine then begins to roll out beyond just healthcare workers and first responders, then we can touch more of the population. So we still have a couple more months of challenge. And so we still need to kind of make sure that we all work together to continue to prevent infection spread while the vaccine takes hold as we build immunity as a collective community.
Jim, let me ask you a little bit more about that, since you have a little more background with the vaccine, and because it is such a hopeful thing for folks. And we are seeing the Pfizer come out. We're going to have Moderna probably coming out with approval on Friday, most likely. Yep. And then we have, what is it, the AstraZeneca vaccine, which
AstraZeneca will come probably in January, I'm guessing, just because of the holidays, but it's not far around the corner either.
So we're at a trickle right now. We expected to see a wave of these vaccines coming in then probably, and really picking up quickly in the next several weeks to months?
Correct. There are projections of being able to vaccinate hundreds of millions of folks, once we have implemented the full process with all of the vaccines available. But it's going to take some time, and it's going to take careful, administration. For example, with the Pfizer vaccine, you've got to get that second dose within a very tight window.
Sure.
And of course, if you start with the Pfizer vaccine, you got to stay with the Pfizer vaccine. You can't switch to the other one. So we got lots of little details that we need to go through. And in the meantime, as community members, we just need to continue to do our part to prevent the spread of the infection.
Right. And I think a lot of people have gotten used to it at this point, 10 months in. If they've taken to it, they're wearing that mask, hopefully, and we can get more people to do that. Danielle, let me ask you about resources right now. We talked about that off the top. And Idaho's always been very challenged in terms of mental health resources. What are you saying in terms of the lack of resources, the difficulty that people are having getting resources, and advice that you would have for them?
Well, I would say from a division level, from a state government level, we actually have tremendous resources, both from state resources and from our federal government partners through emergency COVID funding. So across the state, we have created a COVID Help Now statewide hotline that is staffed by crisis counselors, 8 a.m. to 8 p.m. Mountain Time, 7 days a week. So if someone in a community is being impacted in any way by COVID, they don't know where to go for testing, a family member has just been diagnosed with COVID, they don't know what to do, they don't know how to be safe and be a caregiver. Maybe they've just lost their job and they don't know how to apply for benefits or Medicaid. So we have a tremendous resource in this new COVID Help Now that can really help with emotional support for callers, help build resilience, help with coping strategies in the moment, and refer out to local resources in the community. We've also expanded our substance use programs for individuals that may be experiencing substance use in terms of alcohol or drugs. We offer expanded services if you don't have health insurance and you meet certain income requirements, where we provide inpatient and outpatient services, housing, testing, and case management. So we do have a lot of services at the state level. I also want to mention something that's really, really important, and I want to acknowledge the secondary traumatic stress that frontline and essential workers in the state are dealing with. So this is a big category of individuals based off of employment. So doctors, nurses, any type of clinician in a hospital or healthcare setting that is working with people that may have been diagnosed with COVID. It could be people working at a grocery store, employees at the post office, teachers, etc. Anybody that doesn't have the luxury from working from home and has to go out and continue to serve the public in some capacity. We have created a COVID counseling assistance program where these members can call and help with benefit navigation if they have insurance, for them to understand what their mental and behavioral health benefit is to get them the help they need. And if they don't have insurance or maybe have exhausted their benefits, they are eligible for 5 free counseling sessions with a licensed provider to talk about what they're experiencing in the workplace and their needs. So we actually, at a state level, we do have tremendous resources that we want the public to be aware of. I will let our other 2 guests maybe talk at a non-government level. We do know that as people get through stigma and more individuals reach out for care from a clinician, there can be a backlog in services there.
Let me ask you all that, because we've talked about the stigma that exists with mental health issues. At what point are you hearing people who've never had problems before saying, I realized that I needed help? What do they recognize in themselves that triggers it's time for me to get help? And what would you say to those folks who are still, I'm tougher than that, I shouldn't have to do that? I think that's a common kind of thing. But everybody's in the same boat right now. So what do you tell those folks to look for in the signs that they might need help? Jim, why don't you start with you? I'm sorry.
Sure. So first of all, I'll highlight something that is important. Behavioral health, mental health problems touch everybody. At any given point in the population, 1 in 5 are suffering from symptoms that affect them. That doesn't mean they're dysfunctional. It doesn't mean they can't work. It just means that something is going on that they could get help for. And stigma tends to kind of make us feel like we shouldn't give into that, because either we feel defective or there's something wrong with us. And so we resist reaching out and asking for help. The silver lining of the pandemic is that it's a little more normalized to know that people are under stress and anxiety. And so we're really pushing folks to reach out and ask for help. What we're noticing at Regence is a significant increase of folks reaching out and asking for behavioral health. Luckily, we've shifted so that a lot of our services are now provided through telehealth. But even on-site providers that used to do care, seeing people in person, they've converted their practices to now also provide services, through a telehealth function. And so we've seen the demand for those services go up dramatically, just really, really dramatically. And of course, because stigma has previously prevented folks from asking for those services, if everybody was to come forward at once, I do think there will be some challenges getting services to everybody. So it's really important to make sure that we're very careful about monitoring the situation and continuing to make as many services available to folks.
I'm really interested to get your take on this, Jacob, because I think I've been there just talking to someone. It's amazing what a difference that makes.
Absolutely. And I think, when we look at data, the American Psychological Association did some studies where, nearly 8 in 10 individuals polled said that the pandemic is causing an undue amount of stress in their day-to-day life, and that stress is increasing. Some things that we're noticing for us within St. Luke's and within the community as a whole is there is a large backlog. We've converted the vast majority of our practice across the health system to telehealth and behavioral health so that we can, reach those individuals. But at the same time, there's only so many providers and so many appointment slots. But what we've tried to do is expand access, try and be creative with access, so that we can get people the help where they need. Some things that I usually end up telling people to go to your original point is, pay attention to your routine. When you're starting to find that my normal routine, I'm not finding the interest or the desire to engage, whether that's my normal activities, my kind of normal eating, sleeping habits, when something feels off, that's a good early indicator that I may need some help with this. And that kind of our stubborn nature, especially with mental or behavioral health and that stigma that goes along with it, there's that side of I should be able to manage it. I should be able to try harder and kind of think my way through it. And the message I'm consistently, delivering to people is this a physiological issue. It's like trying to think your way through diabetes. It's the same outcome, and that a lot of times we do need that professional help, whether through just talking to someone or potentially medication, whatever that may be. So some big things that tendency to withdraw from the people in our lives is another early indicator that I tell people to watch for.
Now, you're getting many calls, Jacob, from people who are loved ones who are concerned about seeing that kind of behavior in their loved one, that they're withdrawing, maybe not even knowing it, but wondering what to do. Are you getting an increase in those calls as well?
Yeah, I would say that's something that's been happening more frequently. There's already a fairly high level of difficulty throughout this year, but something more recently that I've been seeing as family members reaching out and saying, "Hey, I'm really worried about my loved one or my friend. They've been struggling in this area. What can I do? How can I encourage them to get some help?" So it's definitely seeming to happen much more frequently currently.
For all of you, I know it's been a long haul. But what is most hopeful to you right now that you're seeing? Danielle?
Sure. Well, I think, we've mentioned the vaccine, and I think we should note that this is one of the fastest times in history that a vaccine has been developed with good science, good outcomes, a large amount of patients in the trial. So I think we're in a really good place with the science. It's showing a lot of promise, because we could be sitting here talking today with vaccine trials failing. And that's an important reminder. I think for me, personally, and what I see in friends and family is this thought of resilience and adaptation, and thinking through, okay, when COVID ends and we go back to normal, whatever that might be, how do I want to be stronger, better? What do I not want to forget about this period? How do I want this to improve my life in the long run? This is a once in a generation, once in a many lifetimes, what we call a black swan event that's happening. No one foresaw this coming, and we all have the opportunity to learn and grow individually as a community and come out stronger. And so that's very exciting for me to think that I can be strong. We can be strong as a community. We can grow and adapt together and ultimately come out stronger at the end.
Silver linings. Jim?
Yeah, I very much agree with Danielle. I do think there's some things that we could potentially learn from this. I think the biggest thing about this pandemic is it reminds us we're all in this together. So it doesn't matter who you are, where you live, what your socioeconomic background is. All of us are potentially, at risk for this virus, and we've got to work together as a community to help each other. Now, I realize there's some divisiveness going on, and there's been some politicization of this. But in the long run, if we can remember the sense of how do we help each other as a community, how do we get through struggles, it's going to set us up to be stronger in the future for other challenges that we might face.
Well, and along those lines, and you mentioned a very important aspect that I think has caused a lot of stress for people too, is that the politicization of all of this has come into play, and it shouldn't, because it's a health issue that everyone is facing. But here we are, it's the holidays, guys, and we've already seen Thanksgiving and what happened with Thanksgiving. And when you're feeling down, you want to be around family. I mean, what are you expecting for the next couple of weeks here in terms of Christmas and Hanukkah and the New Year and all that goes along with that? Jacob?
Yeah, I think we're likely in for a bit of a rough ride over the next month and a half or so after the holidays, and seeing cases and spike after these different holidays. I think my encouragement to people is to be creative. My family lives 10 minutes down the road from me, and we've had very, very little contact over the last 10 months. So we're being creative in how we can still have that family interaction, but doing so in a more safe way that protects us all. But I think band together, the biggest what I'm trying to do for myself, and it's kind of a mantra within our organization, is assume positive intent. Even though someone may be on the other side of this this issue or disagree with your stance, assume that they're coming into it with positive intent, because we don't know what it's like standing in their shoes.
Yeah, I think you make an excellent point, Jacob, that there are people who wonder, oh, it's just wear a mask, whatever their thoughts are politically on the issue. But the bottom line is there's a lot of fear going on right now. When you're losing a job or your business is at stake, that's at the front of your thinking.
Absolutely.
And putting yourself into someone else's shoes in that regard is difficult to do, especially when other people are worrying about sickness. But you mentioned doing things differently for the holidays, and Jim, it goes to your point, and telehealth being a bigger issue these days and more useful, and thank goodness for technology. But it's something that we all can do ourselves, right?
Yep. Yeah. The holidays tend to be difficult anyway, even without a pandemic. We look forward to holidays, time away from work, time with family, but it is stressful. And sometimes you're close to some family members, maybe not so with others. What do I get? What am I going to do when we meet? How are we going to talk? So lots of stress. And then for some people, they see everyone else engaged in all this family activity, but they themselves may not have family nearby. And so there's also a bunch of folks that can sometimes feel lonely. So the holidays tend to be difficult and stressful anyway. Throw a pandemic in there, and it just makes it all the more difficult. One of the things that I remind everybody is, remember that when you're under stress, the basics of just taking care of yourself and taking care of your body can be really helpful. Mm-hmm. So making sure that you're getting plenty of rest, eating well, getting plenty of exercise, try to get out, enjoy that natural light. The more you take care of your body, the better your immune system will be, and the better you'll feel. It will just make all of those things easier to deal with. But it's okay if you're having stress, because remember, it's normal to be stressed because of the pandemic.
Right. And as you point out, so many people are in the same boat right now. We talk about stigma, but when everybody else is dealing with the same thing, maybe that takes a little bit of it away. You mentioned natural light. We don't have a lot of natural light right now. Today, especially, it's foggy out and nasty. We need Rudolph out there. But speaking of that, I mean, get a little light set maybe for your desk, right? Because seasonal affective disorder is a real thing.
It definitely is a real thing. You know, seasonal affective disorder tends to start late fall, early winter, and for some folks can last through spring or even into the summer. We don't know the exact cause of seasonal affective disorder, but it appears to be related to less natural light, less sunshine in those winter months. And so consequently, areas in the country that are farther away from the equator experience a higher prevalence of seasonal affective disorder. So getting a light box, you're looking for a light box that will have at least 10,000 lux, and that's a measure of brightness. So that can be one way of kind of giving yourself a boost of that light that you really need. But even just getting outside away from indoor light can be very, very helpful.
Yeah, exercise so important as well. We're starting to wrap things up here. I want to have everyone go around if there's anything that we've missed that you think has been really important as we get into this really critically important period of time here where the virus has gone out of control and we've got the holidays and there's so many issues facing people. The key here I want to touch on how to get help. What's out there again for people who are really maybe never been in this situation before, what you're going to tell them. And if we've missed anything else, throw that in as well. Danielle, we'll start with you.
Sure. So I'm going to recap from the Division of Behavioral Health how you can get help. But first, I want to say, and I think this has been talked about before in kind of closing comments, create a routine for yourself. Even if you're working from home, you're not a frontline worker, go to bed at the same time, get up, exercise every day, shut work down at a very specific time. For those of us that are working from home, we actually tend to work more and it can be a little bit disruptive without those boundaries. So set a routine. I also want to say, and I realize that we are on with a news station today, but I want to encourage everyone that it is okay to not watch the news. Mm-hmm. It is okay to not continually check the COVID numbers all the time. It is okay to not look at Twitter or Facebook with all of the horror stories on COVID. Sometimes it's good to just shut things down, read a good book, look at a cookbook, and not focus on COVID. You're not going to miss anything, but all of kind of the reading, the reviewing, the constant information can take a toll on your mental health. So just shut it down every once in a while. It'll still be there when you're ready to come back. The Division of Behavioral Health, you can find this all on our website at the Department of Health and Welfare. We have a COVID Help Now hotline that anybody can call for any type of help on COVID. If you're in emotional distress, someone's been diagnosed, you need to know where to go for resources or applying for Medicaid or unemployment, please give us a call. We're here to help you. We have expanded our services for substance use. So if you are struggling with alcohol or drug consumption, we're here to help you and get you the services that you need. And finally, if you are a frontline worker, by the way, that includes journalists, folks that work at this TV station that constantly exposed to kind of the horror of COVID, we are here to help you either help you understand your own insurance benefits to get the help you need and get you the referrals you need, or provide direct care to you with a licensed professional, all available on our website.
I mean, it's fabulous that we have that all available to folks. And I think you make an important point about shutting down the electronics. When we talk about a silver lining, and I agree wholeheartedly with you, that maybe because we've become so absolutely addicted to that aspect of our lives, this will give us a chance to say, you know what, we don't need that all the time. And I think that would be a really good thing. Jacob, let's see what you have for last thoughts tonight.
Yeah, I think some final thoughts is we need to be aware that it's not just COVID we're dealing with. 2020 has been a really challenging year for a lot of people, and so a lot of us are dealing with that cumulative level of stress where kind of each thing that happens is the straw that broke the camel's back kind of a feeling. So I think taking that into account and taking the time to, as Danielle said, set a routine, engage in those normal activities, those things that make us well, be creative. Some of us, our normal activities are not possible right now. So using this as a time to explore new ones. Some other resource ideas is, reaching out to your employer, finding out if you have an employee assistance benefit along with your insurance that usually will pay for multiple counseling sessions. Also, I think important to throw out the Idaho Suicide Prevention Hotline. If you or a family member or loved one is struggling during this time, reach out to your primary care provider if you need help. At the end of the day, if you feel like I'm not managing this well, there's resources there to help.
I think that the routine aspect is so important. We forget, we try and teach our kids routine, right? And they're learning from scratch, but we're now thrown out of our routine. We're learning once again as parents. As a parent, I'm learning how important it is. When you're out of that routine, you're like, what do I do? It just throws you for a loop. And I will say one other thing. Boredom is the mother of invention, if you ask me, and creativity. When we were kids, we didn't have the internet, right? And you had to come up with something to do, figure out, hey, go do something. We don't have that anymore. I just have to turn something on. Well, now maybe it's good that we shut it down and we do something else. Jim, I'll give you the last word.
Sure. First of all, I agree with everything that Danielle and Jacob have said. The most important thing that I think of is reminding folks that if you're struggling, the last thing you want to do is struggle alone. Now, if you're having difficulties, it doesn't necessarily mean you need a counselor or psychiatrist. Sometimes just reaching out to family or friends and just talking with them is enough. Sometimes talking with somebody in a professional sense becomes a little bit more important for some folks. But the key is there's no reason to suffer alone. So if you're having difficulties, if you just can't seem to quite get out of it, start first by just talking to close family and friends. You'll find out, first of all, you're not alone. You'll find out that they're more than willing to jump in and give you a little bit of help. We love to help others, so others love to help us too.
So important. Like we said earlier in the segment, that just talking to someone makes a huge difference. Just do it. Pick up the phone. We have the technology to do that. So that makes such a difference. I want to thank all of you for being here. And again, why don't we end on the final note again? The vaccine is here. It's a huge, but we need to hold the course, wear those masks, social distance, and we'll get through this because the light is at the end of the tunnel. Danielle Peer, Dr. Jim Polo, Jacob Wilson, thank you very much for your insight today. We really appreciate it, and happy holidays.
Same to you. Thank you.
Thanks, you too.